This is the All One Nurse podcast, where we are bridging the gap between the stethoscope and the soul and getting back to the human side of healthcare.
Powered by Riverside.
Welcome to the All One Nurse podcast, where I'm your host, Shenell Thompkins, and I am bringing you a wonderful episode today with my awesome guest, Mrs. Veronica Brown, a board-certified nurse practitioner with over 10 years of experience and a deep dedication to health and wellness. And as evidenced by her own business, The Wellness Lounge, located in Canton, Michigan, and serving surrounding areas. Welcome, Mrs. Veronica.
Thank you. Hi, everyone.
I thank you so much for just being here today, Mrs. Veronica. But before we dive in into our conversation today, I want to ask my listener, yes, you, my listener, to open up your heart to receive this wonderful information as we dive into Mrs. Veronica's background story, her professional journey, and then we'll dive into her educational insight and patient perspective in regards to health and wellness, dealing with nutrition and weight loss, and just tips and strategies of how to move life forward. So, welcome again, Mrs. Veronica.
Hi.
So, tell us about you. What's your origin story?
I'm originally from Chicago,
Okay.
and I moved to Michigan after many years ago. I've spent like half of my life in Chicago and half in Michigan, but I'll always be from Chicago. I became interested in the healthcare field as a child. My mother is a nurse, and so I was influenced by her being a nurse, and I thought that her job was awesome. And so I've always been into healthcare for as long as I can remember, whether it's been like nutrition, nursing as I got older. So I knew that one day I would eventually go into something of the healthcare field. And so I started out in nutrition, and then I worked in long-term care facility. I also worked in research as a nutritionist, and then I ventured off into nursing. Which is how I've met some of my lifelong friends in nursing, because there is no program like nursing. It's like a world of its own.
Yes.
And so you need like all the support you can get. Well, I have been in nursing for 10 years now. I've been a nurse practitioner for 3. I have done things like working in the emergency room, level 1 trauma. I've worked in standalone ERs, but I definitely like the trauma. That's like my favorite thing as a nurse. So I've worked in all of the hospitals in across Michigan, as well as Texas and California. So I have been all around.
Okay.
And then I became a nurse practitioner during COVID. So that was pretty interesting because I actually had my graduation online. It was on a Zoom because we couldn't mix and mingle. So that's kind of like a snippet of my journey.
Okay. So did you have any siblings that went to nursing school too? Or is it just you and your mom?
So I actually have a lot of family members that are in the healthcare field, in the medical field. So I have my youngest sister is actually a surgeon. She's in her 3rd year of residency.
Yes.
She has a little ways to go, but she's amazing. She's going to go into vascular surgery.
Oh, yes.
So, yeah.
I love it because CVs, I love the heart,
Yes. Yeah. She's amazing with her hands. So.
Okay, awesome. Thank you for sharing that. Now, coming through nursing school, what challenges did you face?
Oh my God, many. Because I went to nursing school as an adult, as a married woman. And I didn't go through like a traditional program. I did an accelerated course because I had a degree in another program being nutrition. And so I found this program at UT Health Science Center in Memphis. And I thought it was like amazing that I can go for 2 years and earn my MSN
Got
and,
you.
do that whole thing. So I actually moved to Memphis for
Gee.
2 years.
Wow. So you
Yeah.
did. You moved here just to go to
I
school.
Yeah, I
Yeah.
moved here just to go to school. And
Yes.
trust me, that was like the biggest thing was like moving out my comfort zone because I thought, well, I had never been to Memphis. I didn't know anything about Memphis.
Mm,
I didn't have any friends, no family, nothing there. And then my husband was staying back in Michigan because I mean, his career is here.
right.
So he couldn't like up and leave and just come there with me.
Oh.
So that was like it was a huge challenge, trying to find somewhere safe to live, just
Mhm.
maneuver around a city that
No
I just didn't
idea.
know no
Yeah.
knowledge about. And
Right.
and listen, I almost didn't come. I
Wow.
almost did not come, but there was this when I was looking into the program, they
Mhm.
connected me with a student. Her name is Crystal. So
Mm,
shout out to Crystal for being a huge influence on
God.
me starting my nursing journey because I didn't everything that I could think of. I was like, well, I can't just leave my husband here and like go there. And she was like, no, that's not a reason to not come. She's like,
Wow.
there's been people that were in the program that were married with children and they came with just them and their child. And so everything, I was like, well, I don't know anyone there. She's like, that's not a reason. So everything I said, she was like blocking, blocking, blocking. So I think
Yes.
you kind of need that type of support. And she didn't know me. She didn't
Wow.
know me from anything. She had just got connected with me through a coordinator that was with the program
Mhm.
at UT. And so it just worked out. And thank you so much, Crystal, for your encouragement.
Yes. Yes, that's awesome, and it just shows the importance of, speaking life into people, and she made it to
Yeah.
where you couldn't have any excuses,
None, because
you
everything you
know?
can think of, and it's really a fear and stepping out of your comfort zone. And I feel like I have done that a lot in my life.
Mhm.
My husband tells me that all the time, like you do some crazy stuff, you do some crazy stuff, but it always ends up working out right. So, you
Yes,
know, yeah, for sure. Hmm. No, yeah,
comfortable because that means that we're growing in some aspect,
I
so
totally agree with that.
I
Yeah,
think that's
for sure.
awesome that you even took the leap of faith,
Yeah.
and it worked out because you're still married, so that's awesome, that's awesome.
Yeah.
Now, what's your motivation as of today, like, even then and now, what would you say your main motivation is?
My honestly, my main motivation has always been my mom.
Okay.
Just watching her as a young mother, very
Mhm.
young mom, and still, getting out there and doing what she needed to do to not become a statistic.
Yeah.
And that was like a big thing. I'm like, my mother went to nursing school with small children and, she didn't have a car, but she got on, up early in the morning, like in the wee hours when most people were sleeping to catch a bus, a couple of trains, and that just to
Come
get to
on.
school. Okay. I was like,
Yes.
why would I not? Like, what's the reason? You know?
Yes.
So
That's
thank you, mom.
good. Shout out to mama.
Thank you, mom.
Yes, yes. And that's just evidence
Yeah.
that we can do it.
Yeah, we can
We
do
can do it.
anything. Yeah. You just got to
Yes.
get through that, out of your comfort zone into
Mhm.
something that is uncomfortable and something that's unfamiliar to
Mhm.
you that you just, like the unknown, really.
Right. Thank you for sharing that. So motivational. Just even
Yeah.
hearing about your mom, like,
Hmm.
that's very motivational. Now, what would you say your proudest accomplishment is?
Finishing nursing school because that was no joke. So the one thing I really want to highlight is that Medical school and nursing school are very different
Mhm.
curriculums. Obviously, you're going to go to school longer to become a doctor.
Mhm.
So with nursing, you may have a little issue with getting into a program.
Mhm.
And then you may have nursing makes it to where they're going to do everything to try to get you to fail the program. I shouldn't say
Mm.
that, but it's the truth. Whereas medical school, once you're in there, they're going to do everything they can to keep you in. They're going
Mm.
to give you tutors, resources, whatever they have to do. You really rarely hear people say, I failed medical school. But you will
Mm.
hear more people say that, well, I didn't make it through the next round, or, I failed this class and I had to sit out. We hear that all the time. You
That's
really,
true.
really have to mess up in medical school to get kicked out.
Wow. It's funny you
Yeah.
said that. I joked my first semester of nursing school, it was already a handful of people of color in the
Yep.
program.
Yeah.
And I remember one young lady, she didn't make it through the first semester, and then
Yeah.
we were nearing the end of the semester, and I was riding on like 1 point to pass an
Yeah.
exam. And I prayed to God. I'm like, God, if you just let me pass, if you just let me, I promise I'm gonna do XYZ. And so, the results came up online and I ended up passing. And I really took it seriously because I knew that, hey, it's not hard to get kicked out. It's not hard to fail nursing school if you do not take it seriously off the top.
Yeah.
And I
Yep.
couldn't and I couldn't do what everyone else did because I was a single mom at the time.
Yeah.
I did get to go the traditional route, but I wasn't in a dorm room. I was in housing, and it was
Yeah.
serious for
Yeah.
me. And so I was
Yeah.
like, look, I'm not trying to be a statistic, pretty much, where
Yeah.
not, again, we can all come up from wherever we're at in life, period.
Yeah, for sure.
Whatever
Yeah.
stage, like you went back to school as an adult after having
Yeah.
a degree. So,
Yeah.
that's not the thing. But I knew for me, I had the opportunity and I needed to take it seriously.
Yeah, for
And so
sure.
I'm glad you said that. And I'm proud of you for even doing an accelerated program.
Thank you.
Let
I'm
me
proud of
just,
you too. Listen, we made it out of there.
I'm telling
I feel
you,
like nobody knows what we go through unless you are a part of that. Like my
yes,
girls, I'm still friends with them. I'm still cool with them. They constantly motivate me to be better, to do
yes.
better, in this field. Because when I went into nursing school the first time at UT Health Science Center, that was just going to be it for me. But all of
Mm-hmm.
my peers were like, no, you have to go back to get your NP. And I'm
Oh,
like, why? I'm like, this is
yeah.
enough. They're like, no, you have to go back. I'm like, "Ugh, okay.
Look, well, Mrs. Veronica, thank you for sharing your professional journey and your personal insights. That was very informative. Let's get into patient perspective and educational insights so that we can get back to that human side of healthcare,
Mhm.
especially in regards to your expertise with nutrition and wellness and, of course, weight loss, right?
Yes,
So,
for sure.
I had wrote down the definition of nutrition. Let me tell you the definition, and you tell me if you agree. Here I have, and I quote from careerexplorer.com, that a nutritionist specializes in the study of nutrition and its impact on health by providing guidance, education, and support to individuals or groups seeking to improve their overall well being through proper nutrition and healthy eating habits. Does that sum up what the nutritionist is? When we talk about nutrition, you can't help but to talk about obesity.
I mean, yeah.
Like, you can't help
Hmm.
but to talk about obesity. And I just have some statistics here before we even dive into
Yeah.
nutrition, is that more than 2 in 5 US adults have obesity. And many adults with obesity have other serious chronic diseases,
Yeah.
including diabetes and heart disease. Noting that a lot of these chronic issues are preventable. And so I thought that was very impactful because we treat a lot of these things, especially being in the South, Mid South for me, where we have good soul food and country cooking. But we have to be mindful that a lot of the diseases or chronic health problems that we see are preventable. So, what's your take, Mrs. Veronica?
On the whole nutrition, yes, I
Yes.
do believe that nutrition is a lifestyle.
Mhm.
Which a lot of people is whether I mean either you're eating healthy or not, either you're a vegan or pescatarian or whatever. I do believe that lifestyle plays a huge role in our life overall, and
Mhm.
definitely our health.
Yeah.
Are you someone that are you sedentary, or are you someone that likes to get up and move? Do you
Right.
prepare your meal versus is fast food more convenient for you? And I feel like, when people say that America, like we have so many resources, but we
Mhm.
also lack a lot of resources, if that makes sense. If you look
Okay.
into our underserved communities, and what the options are for people who may not have the money or transportation to
Mhm.
actually make healthier choices when they're depending up on the liquor store, the convenience stores,
Yeah.
the gas station for all of their nutritional
Yeah.
resources. So what do you have in there is processed foods, fried
Yeah.
foods, things that are cheap, yet they're
Yeah.
convenient and affordable to them. So what do we
Yeah.
do? You know? Yeah.
Yeah. That's a
What
good
do we
one.
do? Yeah. So I love talking about nutrition
Mhm.
probably every day, actually. I mean, whether
Mhm.
I'm at my wellness lounge, my med spa, or if
Mhm.
I'm at working at the hospital, I'm
Got you.
constantly talking about nutrition because it affects a lot of
Mhm.
things in our lives. I mean, that people really think about nutrition. They probably think about, oh, like fast food, I'm gonna gain weight. But do you
Mhm.
ever think about how it affects like certain body parts, like your bladder? Because I
Mm.
also work in urology as a nurse practitioner. So, any type of caffeine, um, spicy foods, and things of that
Mhm.
sort will cause the bladder to be irritated, just
Oh.
like you would if you were lactose intolerant and you ate dairy
Mhm.
products. The
Yes.
bladder
Eesh.
is the bladder is
Yeah.
also the same. If you're drinking a bunch of caffeine and you're going to the bathroom like a million times that first a couple of hours, and then you're coming to me and saying, well, I can't stop going to the bathroom.
Mm.
Like I'm constantly using the bathroom, but have you looked at your diet and what are you doing?
Mhm.
And
Oh,
then
that's
weight
good.
also, yeah, and then weight also plays a role in your bladder as well. And so, guys, I would also like to mention that I'm also new to urology as a nurse practitioner after being in the ER as a registered nurse for nearly 10 years. And the bladder is actually very complex. It's more complex than what I thought it to be. There's cancer, there's bladder prolapse that may happen in women who have had children, whether you've had
Mhm.
them vaginally by C-section. There is prolapse as women get older, as you age.
Mhm.
Men also, as they age, I would say around 45 and up, usually
Mm.
50 and up, but some 45-year-olds have issues with their urine stream changing, where it may
Mm.
become weaker because the prostate gets larger in men
Mhm.
as they get older. So,
Okay.
that's when the urine issues start. And then we have the kidney stones.
Yeah.
Yep, kidney stones. And honestly, is really majority of the time is related to lifestyle and what you're eating.
Mhm.
If you're someone that's eating fast food, fried foods, greasy foods, fatty foods, as well as spicy foods, then those are the kind of things
Mhm.
that will bring on a kidney stone. And the
Mhm.
pain alone will send you into the ER. Like you wouldn't it doesn't get better, as you stay home. So it kind of just hits you all at once.
Got you.
And then there's also prostate cancer in men. When men are 50 and above, I think they just changed it
Mhm.
recently, 50 years old to 70,
Mhm.
they start assessing for every year. Well, it's
Mhm.
every year or every 2 years for prostate cancer, which is the number one killer in Black men.
Oh.
Yeah, it's the number one killer in Black men, the number one
Mhm.
cancer in Black men. And it's because of awareness. They aren't aware that
Mm.
they need to have this check yearly. Or you may have people in your family, men that have prostate cancer, and they're too embarrassed to tell their family members it. And that's
Wow.
something very vital, because if you are a male and you have prostate cancer history in your father, your grandfather, your
Mhm.
uncles, yeah, that's something that you would need to know just for the monitoring alone. You know, for
Yes.
someone like that, I would want to monitor them yearly versus the every 2 to 3 years that the American um, Urology Association just came
Mhm.
out with. So, those are just some gems, for the people.
Yeah, so you really dropped a gem that I wasn't even expecting. But you
Yeah,
also opened the door of how important it is to have a primary care provider.
it's so important. It's
It's
so
important.
important. Yeah, yeah. Because your prostate level can be monitored by your primary care
Mhm.
provider. It's when it gets out of control where it
Mhm.
starts to elevate that then you will be coming to see me.
Yes, yes, and it's
So,
even beyond prostate issues for men,
yeah.
like just us in general. We have
Hmm.
to have a primary care provider so that
Yeah,
we'll
for sure.
and I tell them so we'll have a baseline. It's not
Yes.
that they found anything. Well, they don't go finding anything. It was there. You
Yeah.
just didn't know it was there. If something is there to be found, but go when you are healthy so that you'll have a
Yes.
baseline. What's your blood count on a healthy
Exactly.
day?
I'm
If
I'm all about being proactive. I think that's very important, being proactive versus reactive. Because
Mhm.
if I'm proactive with my health, that means I'm going for my yearly annual physicals. I'm aware of what my numbers are. I'm
Mhm.
aware of any changes with my body. Because I feel like people are very dismissive about little changes that are
Mhm.
occurring with them, like shortness of breath. Some people are like, oh, I'm getting older, so I'm short of breath. Well, no, that could be an indication that you may have some type of heart
Issue.
issue,
Yep.
or maybe you have asthma or COPD, even pneumonia. You have to listen to your body. And if it's out of your norm, it doesn't hurt to listen and get it
Mhm.
checked out. Please get a primary care provider.
That's a good takeaway. Get your primary care provider if you do not have one and you're listening to
Please.
this episode. Please. Moving forward, tell me a little bit about on the nutrition side. Tell me a little bit about the Wellness Lounge, and how you serve the community.
Yeah, so the Wellness Lounge is my business that I opened nearly a year ago in August.
Mhm.
It's really started off as me wanting to open a IV hydration center.
Okay.
Because, working in the ER, we see people that come in, they've had too much to drink, and they're like using the ER for,
Yeah.
their hydration needs. We have all seen this, okay, people? Well, now you don't have to go to the ER. You come see me, okay? You have a
Yes.
hangover. You got a hangover, a headache, that's what I'm here for.
Yeah.
So it started out being the IV hydration. And then as I got into taking different courses and then talking to one of my good friends, Ashanti, shout out to
Mhm.
Ashanti.
Hey, Ashanti.
Yes, Dr. Coleman, that is. Okay, give her respect.
Yes.
And she's like, you need to add more services. So I'm like, okay. So I'm like, well, I love like nutrition and weight loss.
Mhm.
And then sexual health is like huge. And that's another thing that I deal with in urology too, is sexual health for both men and women. I feel like my motto is, if it bothers you, then it can affect your quality of life.
Yes.
So if your weight is an issue, then it's going to affect your quality of life, whether it's socially you being too embarrassed to go out, or not feeling comfortable going to a gym, or even
Right.
talking, speaking up with your doctor about, hey,
Mhm.
I feel like I need help losing weight. A lot of people aren't comfortable doing that. So I have my med spa.
Mhm.
It's one on one. It's very individualized to
Got you.
that person needs. So you come in. It's very inviting experience. It's just you and I basically talking about what your goals are and what you want to improve, whether
Got
it's
you.
your sexual health and wellness, or it's your weight, or maybe you just want to boost up your energy.
Mhm.
Because some people have low iron levels, and that's something that I also offer too. It's like an iron injection. Some people may
Got you.
have small children, and small children, they carry
Girl.
so many germs.
Yeah.
Like, I mean, it's like a different type of species. Like, they will walk around with a runny nose, a
Yes.
cough that it feels like they have coughed up their lungs,
Yes.
and you get what they have, and you
Yep.
are sicker than I
Yeah.
don't know what. Okay?
Yes.
Like, I don't have children, but I have small nieces and nephews, and I watch them, and I'm like, seriously,
Yeah.
I was nearly sick for like almost a month with this terrible cold that I could not get rid of. I'm like,
Yeah.
and this one is just running around
Yeah.
just as freely and happy as whatever. So I do have an
Yeah.
immunity boost that I offer. It's really good. So yeah, so people, if you are listening, pull up to the Wellness Lounge and get that immunity.
Yes. 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 And then I said, I know everybody's not in Canton, Michigan,
Yes.
but it's a good thing to know that these services are available as
Yes.
well. You,
But if you're in Michigan, if
yes.
you're in Ohio, you in Chicago, Indiana, y'all can pull
Come
up and come and
on.
see me. Just make a whole weekend out
Yeah.
of it. You can get your hydration. You can get juiced up with some rejuvenation for your, your area,
Yeah.
your
So,
areas. Okay.
yeah.
Get you some IV hydration and some weight loss. We can do all that.
Can do all
Yeah,
that. One
we can do
stop
it all.
shop.
Yeah, one stop shop.
I think that, hey, that's awesome. That is awesome. That's all I'm saying.
And on top of that, I do the PRP. So that's
Mhm.
more like I said, rejuvenation or restorative for hair growth and for sexual health for
Okay.
women with the O shot, and then men with the P shot. So
Okay.
if men are having like erectile dysfunction where
Hmm.
they may have an issue where they can't become erect, or
Hmm.
they can't hold an erection, PRP is amazing for that. Um,
Okay. So tell me more about the PRP.
yeah, so
Okay.
PRP is basically restorative and regenerative procedure that basically we use your own blood,
Hmm.
and we spin it down on a machine, and it separates the red from the gold. And so we take the gold blood, we call it liquid gold, and re-inject it into a body part. So either the
Okay.
penis area or the vagina. We can
Hmm.
do hair as well for hair growth, and it basically restores the area there where it sends more blood flow,
Okay.
or an increase in your the skin cells there. So
Hmm.
it's really good. It's amazing.
Oh, wow. See, I didn't know that existed. I'm learning something new
Oh
today.
yes. Yeah, if
Thank
you
you.
need
Thank you
if the
for
ladies need
sharing
some
that.
cleavage, yeah, come on up. I can do that too. A little cleavage
Okay.
for
You're just a
the summer.
one-stop shop. One-stop shop. And that's awesome though, because that's part of being healthy as well. I think we have to be our best self, not only mentally, emotionally, but also physically.
Yes.
And some fun facts about the Wellness Lounge. If they go to your website, which is VB, your initials, VB, thewellnesslounge.com, they will also see where you have a shot bar where they can get shots, actual alcoholic beverages. But I thought that was neat. You have a shot bar to give them, honestly, nutrition, right?
Yeah.
And you
Uh-huh.
have a music playlist. I thought that was
I do.
awesome. You have one for both intimacy and for working out.
Yes.
I told you I got two.
Yeah.
I had two under two. Now they're growing. They're four and about to be three. But I told you I'll skip the intimacy list, but I'll definitely download that workout list. So I invite my listener to go check that out as well.
Check it
Yes.
out. You please do.
Thank you. So, what strategies do you find are most effective when you're educating your patients when it comes to nutrition or weight loss?
Yeah, strategies for weight loss. I would say being a good listener, because not every patient or client is the same, and they don't all require the same resources. So
Mm-hmm.
everything is very individualized for that person, where they have been losing weight and they had hit a plateau, or they're just starting on their weight loss journey and they need like a boost or a push. A lot of times it's really sitting down and just
Mm-hmm.
talking with them about their health, which is what I do, a
Mm-hmm.
consultation, and we talk about everything from their medical history, their family history, what type of medications they're on, and all of that. It really makes a difference. Just like them coming to me, I have a coach as well. So, I need a coach too. Somebody
Yeah.
got to keep me in line.
Yes, yes. Same, same,
Yeah. So,
same.
yeah. So we all need things that we are offering to other people.
God, yeah,
Yeah.
that's good.
Yeah. Yeah.
And even with that, I think it's not only do we need coaches, but and we may not realize it, but we also have advisors, like who we listen to, who we tune into when we're listening to music or we're listening to programs. It's like you don't realize it, but they're actually your advisor because it's
Yeah,
something that
for
you're
sure.
interested into. So
Yeah.
I think it's nice to put yourself in a space to listen to people that can honestly advise you that they don't even know they're advising you. So okay. With weight management, I saw on your website that you talk about two weight loss injections. One of them
A
is,
lipomino.
yeah, intramuscular, and one is subcutaneous injection. So
Yes.
tell me more
So
about
the
them.
the lipomino and the semaglutide or
Mm-hmm.
semaglutide or Ozempic, because under the Ozempic umbrella is the semaglutide, the
Okay.
Mounjaro, Wegovy, and all of that. I actually use both of those a lot.
Okay.
People come to me primarily for weight loss. So the difference between those is the lipomino is more composed of all B vitamins, and
Mm,
collectively together, they decrease your appetite, they decrease your sugar cravings, as well as helping promote weight loss, turning your fat into energy. And a lot of
got
people
you.
love the sleep effect of it, that it helps you sleep so much better, because of all the energy
Um,
that you have. Like, you're not waking up thinking like, oh my God, I need like 5 to 10 more minutes, or you're not hitting your alarm clock a million times. Like, you're able to get up and
got
go
you.
about your day. Yeah, that can
Okay.
actually be given once a week. The semaglutide is more of a medication
Mm-hmm.
that was created specifically for diabetics, to help
Mm-hmm.
bring their glucose and their A1C levels down or manage
Got
them
you.
better. So everyone thinks that this medication is new, and it's not. It's been out for a
Got you.
while. But when the patients started coming back and they were also losing weight,
Mm.
they said that, oh, okay, we can use this as an off label
Um,
for weight loss. Because you know how you can have a medication created for one thing, and then it's
mm,
also beneficial for
yeah,
something else. And that was the benefit, the weight loss. So
got
that
you.
one, you'll have more increased risk of having side effects like your gastric system. So constipation, diarrhea, nausea, vomiting, that type of things.
Mm,
Because the medication is slowing down your gastric system. So
got
meaning
you.
that it's helping decrease your appetite.
Mm-hmm.
So with that, everything is going to be slowed down. So if you're not eating as much, then you risk the ability to become constipated. So
Got
there are
you.
some things that you can do, that I have clients do for that. You just have to make sure you're drinking enough water daily, that you're exercising, because that makes a difference, and that you're eating the proper nutrition. And a
Okay.
lot of times on the weight loss shots, you have to sometimes remind yourself that you need to eat because you're not as hungry as you would normally be. So that's like a huge takeaway to the people.
Thank you. I think it's very important to
Yeah.
talk about it because it's coming from someone who actually provide the services. And so thank you for giving light to that. That's a service that I don't need, but I still want to be
Right.
able to provide that information to someone who wants to know more about it, especially a patient
Exactly.
or even other
Yeah.
nurses that, well, I'm not at the bedside, but this may help a nurse better educate someone else. Better educate their patients once they come into the
Exactly.
hospital setting or clinic setting. And a good disclaimer that I always
Yeah,
talk
for
about when it
sure.
comes to medications is make sure you always follow up with your provider when it comes to
Please do.
these treatments, and make sure that your physician knows everything that you're taking,
Yep.
because you don't want to take the same medication, but it has a different name, but it all falls up under the same mechanism of action. That's
Yes.
dangerous. So
Yeah.
I did want to
And
make sure I
always,
said
and
that.
two, another disclaimer too is to make sure that you're going to a board certified licensed professional.
Mm.
If it sounds too good to be true, then don't do it. Okay.
Thank you so much for this wealth of knowledge. Thank you. So, as we wrap up this episode, what do you want the listeners to take away today?
I want them to know that for those that are on a weight loss journey, just keep in mind that lifestyle and the medication have to meet in the middle. The lifestyle would be things like making sure you're drinking the proper amount of water, making sure that you're eating a balanced diet, be sure that you get your protein in, because
Mm-hmm.
um, with any weight loss program, you pose the risk of losing muscle. And so
Mm-hmm.
that's how people get that sick, sunken look. It's because you're losing weight, but you're not exercising. So make sure you're during the exercise that you are doing your strength training and that you're eating your protein first and foremost. Before you eat your vegetables, eat your protein. Okay, that's
Gotcha.
important. And just know that the scale may not always move, but your
Mm-hmm.
clothes, the way you feel in them matters. And sometimes you have to take a step back and not focus on the medication itself, but really focus on things that you may or may not be doing, like working out, eating right, not eating as much fast food or fast food at all,
Mm-hmm.
and preparing more of your meals yourself. Because there is
Mm-hmm.
no magic in a weight loss program.
Okay.
Okay.
Thank you. That was good. That was good.
Thank you.
Thank you. Thank you. Thank you. So, how can our listeners contact you or connect with you?
Yes, please follow me on Instagram at that's T as in Tom, WL dot lifestyle. So TWL dot lifestyle on
Okay.
Instagram. Yeah, I can also be reached on my website at vbthewellnesslounge.com. You can also call or text me at 248-404-5523.
Okay. Now, is that your business number?
That is my business number.
Okay.
It's definitely not my personal,
Okay.
people, okay?
I was about to
Not
say
doing
we might have
that.
to retake. We have to retake that part. Okay. Well, thank
No,
you
that's the
so
business number.
much. Thank you so much for being here.
No problem.
So, y'all, be
Thank you
sure
so
to.
much for having me.
Oh, you are welcome. You're welcome. Well, as we conclude this episode, be sure to follow Mrs. Veronica Brown at TWL.lifestyle on IG, as well as her website, thewellnesslounge.com. Okay, be sure to reach out to her, especially with any questions, and just follow her because this is your nutritionist expert, weight loss expert. I'm just saying.
And
Don't.
sexual health too.
Oh, there we go. That's part of healthiness. Okay. And don't forget to follow me, Nurse Shenell, on TikTok, IG, and on YouTube and Facebook at All One Nurse. And be sure to subscribe to this podcast so that you won't miss any of our other special guests that's going to come on as well and give you some very impactful and informative information so that we can thrive together. And so until next time, let your light shine. And thank you. Thank you so much for being here, Mrs. Veronica. I really appreciate it.
Thank you so much, Chanel.